Stability what we get is important. We can get a 17 also, but the same stability you are going to get. Here we got infinite stability. Two more twists, it may break off.
There it will be 3.5 Alex.
3.6.
3.6.
Yes. Here, this part went into the cancellous part. 2 or 3 threads, but 3 or 4 threads are into that part. So in that way, so we could have used 14 also. Okay, since we used 14, 2 or 3 threads they went into.
Is a plan first.
Yes, we planned 14 only. Yes.
So you can see that the extension.
Yes. Okay, we'll start the tummy level. This is the myloid edge. So from here to here we have this place. We could have selected a longer one. This is 10 mm. 12 mm will be better.
This is the length you need.
No. Abutment I could have no. The abutment is too deep. The abutment height, abutment was too much submerged.
நம்ம இப்போ இந்த மாதிரி கொஞ்சம் ரிட்ரைவ் பண்ணி விட்டுறலாமா இல்ல ஒன்ஸ் லாக் ಮಾಡಿ விட்டுறதா
இல்ல ட்ராக் பண்ணலாம் பட் பெண்டிங் பண்ணிட்டேன்னா you cannot retrieve it.
நம்ம ப்ராசஸ் பண்ணுவோம்.
See, if you retrieve it, if you bend it, then you cannot retrieve it, because if you bend it, it will turn like this. So before bending, make sure it is correct. What I should have done is I should have taken the X-ray, then I would
then
have
go for the bending. Okay.
So yesterday many cases we did like the body. We took X-ray. Sometimes when the patient is very much not cooperative, we
touch பண்ணப்போ we will take the then why do we do that?
For length, the abutment was very deep. You can go and check now. The abutment got submerged too much. If you have selected 12,
so length
the abutment, yes, length. So length calculation is very important. But of course, there is enough length is there. So this is also lingual cortical engagement. Lingually we perforated, but the implant didn't go. Not necessary, because here it is getting from here. We could have selected a longer implant. This is the mesial socket. We didn't tilt and all. Just we placed straight away.
The mesial socket or internet tools.
The internet mesial socket. 4.2. Yeah. If you put 3.7, you won't get any stability. So you have to select a wider diameter. If you select a conventional implant to place it will hold nicely, because it is not tapered. It is more or less parallel. It will get more stability in this kind of situation. Here it is tilted. No, not 50 degree. Maybe 30-20 degree tilted. It looks like close to brain border. You will see. But no problem. In panoramic, you cannot don't rely on this X. It looks like it is closer, but it will be definitely some stability. You can see it here. Anymore?
Sir, இப்போ நம்ம பேஸ்மென்ட் பண்ணிட்டா ஆர்பிஜி ல பண்றோம். பேஸ்மென்ட் பண்ணிட்ட உடனே ஆர்பிஜி
ஆர்பிஜி டக்கன் கிடைக்கும்.
Yes. Intraoperative, not only after implant placement, during drilling, during implant placement itself, consult for 60-70%, then take care. So the RVG and laptop should be
must.
Yes. So these kind of things can compensate for the lack of services. But if you know the anatomy, everywhere, whatever implant you do, the base is the surgical anatomy. If you know the surgical anatomy, you can do any brand of implant, any type of implant, any kind of process. The basic is jaw relation aesthetics. If you know that, you can do any kind of, whether complete denture, same principles, excellent. So try to learn the basics. If you understand the basics, then everything is easy. Hey, after that, after 6 months, if you go for a conventional implant course, you may think of doing conventional implant. But if you have the surgical knowledge, you can do any kind of implant. Basically, what we are doing is we are using single phase implant, but in a conventional manner. See, out of this 4 implant, only this is base. See, we could have placed 70 to 80 implants in these 3 days, but only 6 or 7 base implants.